Tori Cooper recently became the first black transgender woman to serve on the Presidential Advisory Council on HIV/AIDS, and she hopes her historic appointment helps shine a light on the disparities in healthcare for the black trans community. "I never expected that those folks would know who I am or have any idea about the work that's being done," she tells NPR. Cooper, the Director of Community Engagement for the Transgender Justice Initiative at the Human Rights Campaign, says she is eager to advocate on behalf of all transgender and non-binary people, including those who are living with HIV. More than 40% of Americans diagnosed with HIV in 2019 were black, according to the latest data from the Centers for Disease Control and Prevention. And black transgender women have infection rates that are nearly 4 times higher than those for white trans women, according to a separate study. In an interview with NPR, Cooper said inequality in delivering healthcare to marginalized groups is a big reason for the disparity in those numbers. "My goal as an individual who's part of a collective is to make sure that we are bringing more equitable health outcomes and even the playing field, to increase people's capacity to live healthily and happily," Cooper said. The Presidential Council Cooper is joining, which was created in 1995 by President Bill Clinton, provides advice, information and recommendations on HIV and AIDS to the Secretary of Health and Human Services. With over 30 years of experience as a health and equity consultant, Cooper has worked to raise awareness for HIV in various volunteer roles and as executive director and founder of Advocates for Better Care Atlanta, which pushes to educate and empower marginalized people across the country. "Being the first of anything is always daunting," Cooper said of her new role on the presidential panel. "But it also is a great opportunity to break down barriers and open doors for other people as well." According to the latest data from the Centers for Disease Control and Prevention, in 2019, nearly 37,000 people have been diagnosed with HIV, with roughly 16,000 identifying as Black, African American. In a CDC study of HIV prevalence in transgender women across 7 U.S. cities, 62% of Black transgender women were infected, compared to 35% of Hispanic trans women and 17% of white trans women. When it comes to black people dealing with HIV and AIDS, the stigmas associated with the virus are the most common barriers to people seeking appropriate care, says the Reverend Rob Newells-Newton, Director of National Programs at the Black AIDS Institute. The group is dedicated to ending the HIV/AIDS epidemic in the black community. "When people feel stigmatized, they're not motivated to go get tested for anything, if there's stigma around HIV," Newells-Newton told NPR. "That's why culturally appropriate healthcare is really important in helping to reduce stigma and get people engaged in care."